The individual opinions of previous TIF procedure patients presented in this video do not reflect the opinions of Endogastric Solutions, Inc. and should not be considered as medical advice. Always ask your doctor about all treatment options, as well as their risks and benefits. Only your doctor can determine whether the TIF procedure is appropriate for your situation. While clinical studies support the effectiveness of TIF, transoral incisionless fundoplication, in treating chronic GERD, gastroesophageal reflux disease, individual results may vary. There are no guarantees of successful outcome. The TIF procedure may not be appropriate for every individual, and it may not be applicable to your condition.
In 2001, I started to have problems sleeping. I would be uncomfortable after meals, particularly meals that had a lot of fat. My wife and I ride bicycles quite a bit, and we have done over 15 week-long camping rides, and I just totally gave those up because in a tent and you're suffering from GERD and you can't sleep is not a pleasant place to be. I struggled for 10 years with GERD. I would get some relief from the medicines. I tried twice a day with them, but I still would get pain and discomfort from it. GERD affected my social life in that going out to eat was often, I would dread it. I'd have to say, I don't think I'd better go there because I may not find anything to eat. I learned about the TIF procedure from the doctor that I went to, the general surgeon that I went to for my 5th endoscopy. And I went to the heartburn center, and they talked about it, and I thought, I'm going to go for it. And compared to the other procedure that was possible, it would allow me to vomit if I ever got sick. It allows me to burp. A gentleman that I taught with had had the other procedure, and his was too tight, and he had to have about 6 endoscopies to try to stretch it. With the TIF, I didn't feel like that was as much of a problem. I think my favorite food for the 2 weeks after the procedure was probably Ensure. It seemed to help settle my stomach. It took 3 or 4 months, but I got back so I can drink coffee, and I can enjoy about any food I want. I enjoy eating donuts, pizza, tomato sauces. I like tomato products, chocolate, even an occasional beer. So, since I had my TIF procedure, I haven't been on any medicines for heartburn or reflux or any of that. I'm able to eat. I can pretty well eat. I can eat whatever I'd like to eat, and I can get on and ride and not have the problems with the GERD. I would like to say, if anyone has GERD to any degree, I would suggest that you find a doctor who can do the TIF procedure and go see them, have them evaluate you, and if you are to the point that you do need to have something done more than medicine, if it's bothering you too much, I would seriously consider having the TIF procedure done. It certainly worked for me. I'm glad that I had it done, and I think it was one of the best moves I've ever made in life.
All surgical procedures have risks. Therefore, it is important to understand the associated risks. Before you decide on a procedure, speak to your physician in detail about the risks and complications that may occur. Expected risks or discomforts as a result of an endoscopic procedure include sore throat, left shoulder pain, temporary abdominal pain which can be treated with standard pain medication, temporary difficulty swallowing due to swelling, and nausea or vomiting. These expected events occur in more than 25% of people who have the TIF procedure. They are usually mild in severity and resolve themselves shortly after surgery. The TIF procedure may be right for you if you are at least 18 years old, have symptomatic chronic GERD, require and respond to pharmaceutical therapy, have a hiatal hernia less than or equal to 2 centimeters, and have a BMI less than 35. The TIF procedure may not be right for you if you have a bleeding disorder, chronic cough, stricture, severe esophagitis, esophageal diverticuli, an obstruction, a paraesophageal hernia, limited neck mobility, osteophytes of the spine, esophageal varices, esophageal infections or fungal disease, or esophageal stenosis. The procedure may not be right for you if you have anatomy that would prohibit insertion of the esophagus device, if you cannot adhere to the post-operative diet recommended for appropriate healing, are under 18 years old, have a hiatal hernia greater than 2 centimeters, have a BMI greater than 35, or are pregnant. Your physician may have other criteria he or she uses to determine whether you are an appropriate candidate. Ask your physician to discuss those criteria with you. To find a physician that offers TIF near you, visit gerdhelp.com. That's GERD help.com, and use the physician locator.